Chapter 3, Part 4. So we're moving on to staining, and we're going to talk first about gram stains. And in your book, there's a picture of this, I believe, on page 79. So, like I said, the gram stain is a test we do in the lab to give us the ability to differentiate between either gram-positive or gram-negative bacteria. Based on that information, the doctor can better choose the medication to treat the patient. So if, you would use different, in most cases, different antibiotics because antibiotics are going to be used for bacterial infections. In most cases, you're going to use a different antibiotic for a gram-positive bacterial infection versus a gram-negative bacterial infection. So if the doctor puts you on a broad spectrum medication, then sometimes broad spectrum medications are absolutely are contributing to bacterial resistance. So we want to choose a medication that is pinpointed to the infection that you have. So it speeds up the way or the ability for the doctor to treat a patient by doing a gram stain. And a gram stain is a very quick test. Basically, they culture, if it's a wound culture, they culture it, or if it's sputum, or if it's urine, or stool, or although I don't think they would do this on a stool culture, but pretty much most cultures that come down, we can do a gram stain on it fairly quickly. We're talking minutes. It takes 5 minutes, 10 minutes, 10-minute turnaround time tops. If you have an infection in your blood, and we do a gram stain, then it's, obviously the bacteria has to grow for a little bit in the bottle, and when the bottle comes up positive, then we will do a gram stain on that. And when that happens, it's a fairly quick turnaround time once we do the gram stain. So the first thing in a gram stain is we're going to smear the specimen on a slide. We're going to let it dry, and then we're going to do what we call a heat fix. And basically a heat fix is run it over a flame for about 10 seconds, or if you're using an incinerator, then we just run it over the top of the incinerator to basically heat that slide. And heat fixing, what it does is helps the smear that we've made to stick to the slide. So when we add all these chemicals, it doesn't just wash off that specimen, which happens on a regular basis in the lab, meaning student labs, because we're learning, and sometimes students don't do things quite the way they're supposed to, and that's how we learn. So after we heat fix, then we take it over to stain it at the staining station, and the first thing that we would do is add crystal violet. So crystal violet is the primary stain, and we basically flood the stain with the crystal violet and let it sit for about a minute. And what that does, whether it's gram-positive or gram-negative, and you can see here what it's going to do, this is the result of the stain, is it's going to stain every single cell, this dark blue-purple color, okay? Regardless, it is not discriminating on the cells that it stains dark blue-purple, okay? So, and this shows kind of what's happening in the cell wall. In the gram-positives, that big, thick peptidoglycan layer gets stained. And in the gram-negative, the thin layer of peptidoglycan gets stained, okay, as well as that outer membrane. The next thing that we do is we add Gram's iodine. Gram's iodine is a mordant, M-O-R-D-A-N-T, M-O-R-D-A-N-T, mordant. And this stabilizes the primary stain or the primary dye. And there's some stuff that happens, and I don't really worry about that, but basically it helps that initial crystal violet stick, okay, specifically to that peptidoglycan layer, okay? So we add the mordant and we let it sit for about a minute and then we rinse it off. And I'm going to revert back here for a second. I don't know if I said that we leave the crystal violet on for about a minute and then we rinse it with water, but we do. If I left that out, I apologize. I get all excited about all this other stuff. So apply it, let it sit for about a minute, rinse it off, and we get purple cells. Graham's iodine, it's not a stain. It happens to be the color of iodine, but that doesn't matter. It's not a stain. It is a stabilizer. It helps to help the crystal violet stick. So it doesn't change the color of the cells. Therefore, once we rinse off that iodine, then basically it just really helps that stain adhere, and we move on to the next step. It's still purple, right? We're still purple after the addition of the Graham's iodine. And of course, we've rinsed it off with water. The next step is the alcohol decolorizer. So we apply the alcohol decolorizer. We only leave that on for about 5 seconds because it doesn't take much, all right? So what happens when we add the alcohol is it doesn't really do much. Maybe it does take a little bit of the stain out on these gram-positive cell walls, on that peptidoglycan on the gram-positive cells. But that's so thick. It's that big, thick, heavy sponge. It's only going to get rid of so much when we add that alcohol decolorizer. So after we add the alcohol decolorizer and we wait the 5 seconds and we rinse it off with water, the gram-positive cells are going to stay that deep purple, right? However, if you remember, we talked about the makeup of the gram-negative cell wall that has that outer membrane, that outer cellular membrane, and it is destroyed by the addition of alcohol. And on top of that, that outer membrane is going to be destroyed. And then also that peptidoglycan layer is so thin that when we add that alcohol decolorizer, it will wipe out that stain from that peptidoglycan. So after the addition of alcohol, we wait 5 seconds and we rinse it. The gram-negative cells now become colorless because that's what they were initially. They're colorless. We have to stain things to see them under the microscope. So it goes back to colorless. Now we go to the secondary dye, or and there's another term for this in the book. I think it's secondary, primary, counter stain. Sometimes they call it a counter stain, and that is safranin, and it is a pinkish reddish dye. So if you have something that's deep dark purple and you add a red dye to it and you leave it on for a minute and then you rinse it off with water, that deep dark purple really isn't going to change. It's going to stay purple. However, with this one, with the gram-negative, it went colorless in the last step. Now we add the pink red stain and it's going to turn these cells pink. They're going to pick up that pink stain, right? So here we add the red stain, the pink stain, and it turns that peptidoglycan layer pink. And we rinse it with water. It remains pink. This remains purple. And that is the difference between gram-negative and gram-positive. On the cellular level, that's what determines the difference in a gram-positive and gram-negative cell. So you should be aware of these steps for the test. You should be aware of the terms crystal violet, Graham's iodine, decolorizer or alcohol decolorizer, and then safranin. Know that crystal violet is the primary stain. Know that safranin is the counter stain or the secondary stain. Know that Graham's iodine is the mordant that helps that stain stick, that initial stain. And know that alcohol helps to decolorize the cell in order for us to distinguish between gram-positive and gram-negative. And the most important step is going to be the decolorization step. Because if we don't do that right, then these will probably still be purple by the time we get to the stain, and then we won't be able to tell the difference. That's if we don't decolorize correctly, as in don't leave the alcohol on long enough. But if we leave the alcohol on for an extended amount of time, then eventually the stain will go away. So really, if we don't do this step 3 correctly, the alcohol decolorizer step, then it's not going to be a good outcome. So I'm gonna because I took so long to explain that, I'm gonna stop this here, and we'll pick up on different types of staining here on out, because the gram stain is an important part of this chapter, and I want everybody to be on the same page. So I will pick up on part 5 of chapter 3.